as a profession, optometry does need to, in effect, grow up and be more outcome-led and gather data to actually demonstrate its impact in this country.
I was talking with Paul Morris and Pete Larson about how we need data, not just clinical data, but financial data to prove that we're of good value for money.
My strong belief is that individuals really want to understand their impact, and by understanding their impact, inevitably individuals will perform better in terms of health outcomes and also commercial outcomes.
Unless we have this data and financial evidence, I think we are going to struggle to get better relationships with the government and the NHS, because there is no more money. It's then about proving that we can deliver better patient health outcomes, which does save them money in the long run, and we don't have that data at the moment.
When we first set out clinical reporting in Australia, in the next 3 months we saw significant improvement in clinical outcomes.
When I speak to ophthalmologists, the key perception they have of optometrists is that we clog up their clinics with over-referrals. So if we are going to get ophthalmologists to help champion our cause within the NHS tent, then we've absolutely got to face the brutal facts and help them. And ultimately helping them and patients is by reducing over-referrals. If you think about how many referrals are going into ophthalmology every year, there are about 1.9 million, of which 30 to 50% of those are false positives. So it may be up to 1 million patients every year are ultimately being clogged up in outpatients departments. They don't need to be there. We're causing them stress. We're causing them to take time off work. We're putting stress in terms of ophthalmology time. That's probably not, causing some of the backlogs as well in terms of glaucoma follow-ups. So I think we have to accept we're part of the problem. And that's just not Specsavers optometrists, that's everyone. And I think we've started to measure it so we can be really clear on our referral rates. And I would urge everyone within the sector to start measuring their own referral rates.
And I gave a presentation at our clinical conference in Australia in September. I was able to explain to the individuals in the room, the people that they'd actually saved the sight of was of the order of 32,000 people over that 12-month period, which is incremental impact on the previous year.
We absolutely want to start making sure that the clinical outcome report is used on a regular basis by all our clinicians, embraced. And then ultimately we are absolutely addressing our false positive referrals. We'd love to work with ophthalmology closely as well on that. As I mentioned earlier, it's the biggest thing that they want us as a profession. We would love the rest of the profession to come on board. This is a sector-inclusive strategy. We would love everyone around to say, actually, we are as a sector going to address the referral challenge.